Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson, and we're really fortunate today to have a great guest, Dr. George Paz. Welcome to the show.
Thank you very much.
Really a pleasure to have you on, and you've been with us before, so welcome back.
Appreciate that.
And today we're focusing on post-traumatic stress disorder, which is one of those issues that's terribly important, but sometimes a little bit difficult to talk about. And Dr. Paz, I know you from before, and you're a superb guest for this subject because you're a psychiatrist, right?
That's correct.
And tell us a little bit about your clinical history, particularly with treating veterans.
I worked at the West Los Angeles VA Medical Center for about 10 years as a psychiatrist. And the first couple of years was just a regular general psychiatry program. But then they initiated a PTSD unit. It's called Specialized PTSD program. And they had, it started off as an inpatient type program. There was a prolonged hospital stay. There was group therapy every day. There was individual therapy every day, relaxation therapy. So we actually did a lot of the development of the VA's PTSD treatment programs that now exist. And we were making a difference, I feel. We were doing research, we were doing programs that hadn't been done before, making it up as we go along kind of thing. And I am proud to say that we had success. Not everybody, but those that completed the program generally feel like they were much better. And it's an ongoing process, obviously, but they were really succeeding on a different level.
And we should note that PTSD also can exist outside of the military. I know you practice in other settings as well.
Yes, I've treated police officers and people in traumatic experiences and things like that, assaults.
So lots of people talk about PTSD. They may just use the acronym, but they may not really know what it is. So we're trying to raise awareness about this issue. And I wonder, Dr. Paz, if you could just sort of explain to us what PTSD stands for and what it actually is as a psychiatric condition.
Post-traumatic stress disorder is part of the anxiety disorder family. And then, as the name suggests, it involves having had a trauma. And there's different kinds of trauma. Combat trauma is the most common, I think. But there's sexual assaults, there's accidents, there's other kinds of traumas. And they do produce symptoms of PTSD in many respects. I can go into the symptoms later, but PTSD probably has been around all through history. In the Civil War, after the Civil War mainly, they called it soldier's heart. And then combat fatigue after World War I, and then combat neurosis after World War II. The term neurosis is developed because of the psychotherapy model and the treatment model. It was felt that was kind of a neurosis, but that was a large catch-all category.
I wonder, Dr. Paz, if the evolution of understanding of PTSD just goes along with the general development of psychiatry as a more sophisticated specialty, because I recall when I was a physician in the Air Force, one of the things we were taught is try to avoid sending people home with psychiatric problems. Give them rest and relaxation, and then send them back into combat or wherever they have to be. And they emphasized the stigma of getting what they called a psychiatric jacket, meaning a psychiatric label. And I think both our treatment and also our awareness of this issue with stigma may be a combination of things that have evolved over time. Wouldn't you agree?
Yes. It was a very hard diagnosis to make, in the sense that it did categorize them as having a psychiatric illness, which it's easier to understand a physical diagnosis. But when it affects the mind, and I'm not talking about brain tissue, I'm talking about the way the mind functions. So when there's an alteration in the way the mind functions, then people tend to sort of doubt it or not accept it or have trouble imagining how it's going to be fixed. So it comes from a good, solid foundation, but it's still hard for people to accept it.
Dr. Paz, what is the scale of this problem? In other words, is PTSD a major health issue among veterans, among members of the public? Is it being appreciated sufficiently? Do we underappreciate it in terms of its prevalence? Give us a sense of your view on that.
Well, the prevalence is 8% of the population has PTSD. Not all are combat. Maybe about half of that is combat related. But as I say, there's a lot of civilian and conditions that are included in PTSD diagnosis. People that have had an automobile accident can develop PTSD.
We were talking off camera about whether this condition is over or underdiagnosed, and I think you pointed out rightly that the issue is to diagnose it correctly when it's appropriate, and
Right.
not necessarily to think of it in those terms. I know that when I was preparing for the show and I read the DSM-5, there was an emphasis on physical or sexual assault, things of that nature. And what I'm getting at, to be sort of asking a provocative question here, is that, for example, I see injured workers as a qualified medical evaluator.
Mm-hmm.
And on occasion, I see people who say, well, I have PTSD because my supervisor was very mean to me and mistreated me verbally and so forth. And I want to be respectful, and I end up deferring these cases to psychiatry. But I sometimes wonder, is the condition overdiagnosed? And you mentioned 8%. That sounds like a really high prevalence. Mm-hmm. I believe the prevalence of psychiatric illness is about 15%, right?
That's right.
So that number sounds terribly high. Do you believe it's accurate?
Yes, in the sense that you have people that are traumatized by any number of conditions and situations. And so I just guesstimated that half of it is combat related, because that's where you do see the predominance of severe trauma associated with other difficulties in life. And trying to understand that, you do develop that as the diagnosis. A person that's just been harassed at work or demeaned, I would question it, because it may not qualify as a severe enough trauma to warrant that diagnosis.
I must say that I've also over the years evaluated veterans who have tremendous trauma and police and firefighters who have been shot and burned and everything else. So I'm not in any way minimizing how terrible it is to underdiagnosis. I just thought I'd ask about that. What are the treatment modalities that we have available for this, Dr. Paz?
So I break it down into medication treatment, individual therapy treatment, and group therapy treatment. One of the things that I always like to emphasize is that oftentimes there's a lot of comorbidities with PTSD, like substance abuse and a severe depression or other psychiatric disorder, so that and you need to help all of that. You can't just treat the PTSD by itself. So, for example, in our inpatient program, we would have groups that focused on depression. We would have, of course, people get involved in AA and stay involved in AA or NA. And we would often have family treatment, because we know that PTSD does affect the whole family. It's not just the individual. It's the spouse, the children, and other relatives. So we encourage all of that to be treated, not just the PTSD.
What is the prognosis for PTSD? I imagine it depends on the treatment, but let's assume you treat it as best you can. What's the prognosis?
Well, the prognosis is getting better and better. I will tell you that. It's not 100%, and it may be around 50% of people doing well. I'm not going to say that they are cured because it's an ongoing process, but they're able to live full lives. They're able to do the things they want to do without too much interference with their symptoms. But do they still have symptoms? Yes. Do they suffer? To some extent, they still suffer.
I guess in medicine, whether you're a psychiatrist or whether you're practicing internal medicine or rheumatology as I do, it's rare that we ever have something that's a complete cure. So what I hear you saying is this is a chronic condition that requires chronic management.
That's correct.
And what are the goals of therapy? How do you measure success?
The goals of therapy are a reduction in symptoms. And for research purposes, we like to say at least 50% or more. We jump up and down if we get like a 80% reduction in symptoms, because the symptoms themselves become hardwired into the brain. They become automatic responses to certain situations that a person deals with. And so what they're learning a lot of times in therapy is how to live with the symptoms that can't be extinguished completely.
Dr. Paz, our time together is beginning to wind down, but I would just like to ask you, what can we do to better support and help, particularly our veterans and also our first responders, police and firefighters, and anyone else suffering with PTSD? Are there any approaches that we as a society could take that might be helpful?
Well, I always encourage people to get into treatment. I didn't get to fully explain about medication. We do use medications, but that hasn't turned out to be the best treatment. Individual therapy and group therapy, in my mind, are really, really what people need. Even if they were given medication and it was helpful, you're still left unprepared for dealing with some of the issues and some of the symptoms of your PTSD.
Do you see research on future treatments that might improve how we can help people with this condition?
I think that has been a lot of improvements in use of medications. The two psychotropics that are approved by the FDA for PTSD, and there's only two. One is paroxetine, which is Paxil, and sertraline, which is Zoloft. So those have gone through the rigorous, double-blind, placebo-controlled process, and those are the only two that have been approved. But there are trials now with MDMA, which is a stimulant. They use sedatives to some extent. I think those are more like Band-Aids.
Okay. Well, Dr. Paz, you really brought a fantastic clinical perspective. Again, thank you for all you've done to help patients dealing with this over the years and for sharing your knowledge with our audience. And we're going to speak to someone now who's actually been suffering with PTSD and really can share knowledge as a veteran and as somebody who personally has experienced this. Thank you so much, Dr. Paz.
Thank you. Appreciate it.
As we continue to focus on post-traumatic stress disorder, we have a great friend of Health Focus, Mr. Alfred Sims, Director of Veteran Services for Solano County and a good friend of our show. Welcome back.
Thank you, Dr. Scott. It's a pleasure to be here with you today, and it's always an honor to get a chance to come with you and talk about our great veterans in Solano County and our efforts to help them get access to the benefits they deserve.
I know that your office does fantastic work. I visited it, and it's just first rate. It's is it 675 Texas? Or?
Yes, sir. Suite 4700. It's the county building in downtown Fairfield, and we have 4 staff members on staff there to help our veterans process their claims, to get their college fee waivers, or do anything they need to do to access the benefits available to them in our county.
I know we're both veterans, and I just want to thank you for all you do for the veterans community.
And same here, Dr. Scott. I thank you for focusing a lot of your attention on our veterans community. We appreciate it. As a veteran in the community, we definitely appreciate it.
Absolutely. And as we're talking about post-traumatic stress disorder, I know that you can offer some insights both in terms of the services you offer and also your personal experience. So share a little bit with us about post-traumatic stress disorder and what it means to you.
Yes, sir. So for me, PTSD is a very personal issue. I'm a war veteran myself, first Gulf War. And one of the things that what was pretty common in the military when I got out was the idea that when you come back from combat, it's really important that you don't burden the society with the issues that you're dealing with from combat. So some of the advice they gave me when I first got out, I was 19 years old, just getting out of the military after the first Gulf War. Some of the advice they gave me was to make a box in the back of my mind to take all the bad things that happened during the war, put them in that box, close that box up, and try to forget about it and move on with my life. For a period of time that was effective. I was actually quite successful after I got out of the military. I got a pretty good job over in Germany, got married, came back here and got a job at Genentech, but my personal life suffered a lot from not addressing the issues of PTSD. I ended up losing my first marriage because of issues related to PTSD, and I had a hard time establishing relationships after that because I hadn't got treatment for my PTSD. So I was able to adapt. I was able to turn my hypervigilance into an asset, but it also was a real burden on me pursuing my personal life. I was very fortunate when I came here to Solano County. I met some social workers on base at Travis Air Force Base, and they convinced me of the importance of getting treatment. They were aware of the stigma associated with, admitting that you have PTSD and looking for treatment for it, specifically in certain demographics. One thing in my community, in the Black community, there's actually a stigma associated with not just admitting to a mental health issue, but openly discussing things like that is sometimes considered like a weakness. So part of my goal in coming to talk to you today is to try to not to give my veterans a negative, false hope about how other people might stigmatize their mental health, but to tell them that even if there's some stigma associated with getting treatment, it's definitely helpful, and that if you go through the steps and processes of getting treatment, on the other end, you'll find yourself much more successful, and you'll find that your social life is much more full, wholesome, and healthy.
You know, it's interesting that you mentioned the African American community because we happen to be filming during Black History Month.
Yes, sir.
And perhaps you could shed a little light on the extent to which that particular concern with mental health related stigma has been embedded in the Black community and the extent to which it may have changed over the years. Do you feel like you can tell us a little bit more about that?
No, absolutely. And I'll talk mostly from a personal standpoint. For most of my life after the military, I didn't seek what would be considered professional mental health treatment, but I did get help from mentors in the community, particularly pastors and people in the religious community. And so for many people in my community, while they may shy away from what we might consider traditional Western medical treatment for mental health issues, they gravitate towards more cultural, religious
That's very interesting
institutions to help out with that.
You know, I think clergymen and clergywomen can be also counselors in a real sense. So that's worth recalling. Obviously, there's a level of training that you have in a psychiatrist, for example, that you might not have elsewhere. Still, many people are in a position to counsel and help others. So that's very interesting. So perhaps we could shift gears and talk a little bit about the resources available to veterans. Maybe you could talk about how you availed yourself of them and what's available for other veterans who are dealing with similar issues.
So one of the The great areas of progress within the VA over the last 5 years is they've been able to provide a massive amount of funding for veterans with mental health issues and veterans dealing with homeless issues. So there's a lot of federal funding in our community to help veterans. I think the biggest issue facing our veterans when it comes to accessing mental health treatment now is access to professionals. The VA, they're trying to recruit new psychiatrists, psychologists, and licensed clinical social workers to assist veterans with clinical therapy, with evidence-based treatments, and with medical treatments, but the lack of personnel is a real hindrance. In our area now, a lot of our veterans are doing their mental health counseling through telehealth, because there are nobody in our local area that can help.
Now, I understand that even at Travis, at the VA clinic there, that you've encountered a lack of availability of a psychiatrist, not necessarily through any fault of that clinic or the VA, but just due to difficulty recruiting psychiatrists. Is that true?
Oh, yes, sir. And the recruitment issue is, while it affects me personally here at Travis, it's system-wide at the VA. When it comes to mental health professionals, the VA, they're able to attract mental health professionals on the front end of the career when they're just getting out of school and they're doing residency. And at the very end of the career, 10 years before retirement or so, but they're losing them during that 20 or 30 years during the prime of the career. The VA is working hard to try to find ways to address that, but it's apparently it's not just an issue within the VA, it's an issue in the broader mental health sphere. So.
Right, and do you see differences as you look at the broader Northern California system? For example, there are also clinics in Martinez, obviously Mare Island, out at Mather near Sacramento. Is there a sort of system-wide difficulty having sufficient access to mental health providers, or do you have any insights into that?
No, absolutely. The lack of staff makes it a system-wide issue. Yeah. If you're in Sacramento or if you're in Martinez, you have access to a larger healthcare facility. So there are more physicians, more clinicians there, but the issue is system-wide.
Now, if somebody comes in and needs help and talks to you as the Director of Veteran Services in Solano County, I'm sure you have to look at their whole situation kind of holistically. For example, at the very beginning, they really need to get a VA card. If they're eligible to be service connected, that's something that has to be pursued, right?
Yes, sir. So when you walk into our office, we do an evaluation for you. If you're service connected, we help you get service connected benefits related to issues that occur to you while you're in the military. But if you're just a veteran, we're going to connect you with all the resources in our community that are available to a veteran. You may be eligible for a veteran's license plate. You may be eligible for a college fee waiver. That's a huge one in our community. A lot of veterans don't know that if you're 0% service connected, you can get a college fee waiver for your kids to go to school at any state university, community college, or and that is a huge benefit, particularly in our community. We have a lot of retired military in our community, a lot of veterans, and a lot of us send our kids to school with that college fee waiver.
I thought it was 10%, 0%?
No, if you're service connected, all you have to be is be service connected.
Okay, well, see, that's why we have you on the show. And we covered a little bit of this last time, but I'm thinking about with PTSD, if you could help people with their stressors in their lives, financial, accessing general medical care, that's got to help them overall. And I guess another issue is, you mentioned housing, but also substance abuse. Can you help get people into treatment for that?
No, absolutely. And one of the things we do with our community of care is that we have an approach we call Housing First, where we go out in the community, we try to find those veterans who are homeless, who have those comorbidities, dealing with substance abuse, dealing with the mental health issues, and we first try to get them in housing, and then we try to provide immediate support for them once we get them in housing. So get them off the street and then get clinical support for them immediately, and we find the more you give supportive housing to those veterans, the more likely they are to continue with the housing and to be able to succeed later on.
As you talk, Dr. Sims, with veterans and as you consider your own experience, I want to ask you something that I really didn't get much of a chance to get into with Dr. Paz, and that is prevention. When you look back at your experience in the military, and I realize it's subjective, do you feel that anything could have been done at that point to help prevent the development of PTSD? For example, it's been suggested that in World War II, coming back to the mainland on ships with a long period of time with other soldiers helped people to decompress. And it's been suggested in Vietnam, people came back too quickly. I know you and I were both in the service during the Gulf War, and you deployed. You know, I didn't. I remained in the U.S. But you know, just do you have any thoughts about how it could have been handled better?
No, absolutely. So one of the things that you lose when you get out of the military is that sense of camaraderie and community. If you live in a community like Solano County, you already know that the retirees who get out of the military, they kind of maintain that sense of community and camaraderie, and I think that leads to a lot of stability. So I think the current method of addressing veterans 6 months before they get out of the military through the TAP program, getting them connected to their resources before they get out, and making sure once they get out, they maintain that connection with the military, that could do a lot to alleviate, not eliminate PTSD, but to alleviate some of the complications that are associated with PTSD.
Right, so we want to, if possible, lower the burden of PTSD at the origin of it, but we also want to treat it long term. And as our time begins to run low, do you have any closing messages for veterans? I mean, I think an obvious one I would share would be to go visit the Solano County Veterans Office and to avail yourself of the resources that are there.
So our veterans and our active duty, the Vet Center is a very unique program. You can go into the Vet Center as an active duty soldier. You can meet with a counselor. You can talk about issues related to your trauma that may be causing your PTSD, your depression, or your anxiety. You can get treatment for that trauma, and they never report it to your commander, and they never report it to your VA or your job. By congressional mandate, it's secret, and for veterans, this is also a personal issue for me. One of the issues why I didn't want to talk about my PTSD is because I didn't want to lose my security clearance. That security clearance gets you access to great jobs in the government. If you don't have it, you don't get those jobs. So go to the Vet Center, you won't lose your security clearance.
Fantastic. And as you look to the future, Mr. Sims, do you feel optimistic that we're making important strides here for all members of the community, whether veterans or non-veterans, but I realize veterans is the major area that you're dedicating your life to. But are we making progress in getting the word out that we should try to help people with PTSD and try to get rid of this stigma that we've discussed?
You know, I believe we are making progress, but I think the stigma associated with any type of psychological, mental health, anxiety-related symptoms are pretty long-standing and historic, and it's hard to alleviate those types of stigmas overnight. So I think we're working really hard towards it. I know in the VA, we're working hard to make sure that all of our veterans know inside the system, we know what they're capable of. And I'm hoping by talking to you and showing veterans that, you know, I'm a vet, I have PTSD, and I've been able to make it, you can make it too.
Mr. Alfred Sims, thank you again for being with us, and we appreciate all you've contributed to the discussion on PTSD and all of your service to your country.
Thank you, sir.
Remember, here at Health Focus, we focus on your health. Today we focused on post-traumatic stress disorder, and we hope that if you have anyone in your life who may be dealing with this, that you'll do the best you can to help get that person treatment. And we wish you all the best. Take care.